Hi, this is Dr. Nataraj HM. I'm an orthopedic surgeon specialized in the field of shoulders. Today I'm going to educate you on common symptoms which indicate that you have a shoulder problem. First of all, stiffness. Stiffness is one of the common symptoms which indicate that you have a shoulder problem. Stiffness in the arm, unable to lift your arm for doing over the head activities, taking the hand backwards for dressing or undressing. This indicates that you have a frozen shoulder. Frozen shoulder is a condition where movements of your shoulder are restricted. Frozen shoulder is commonly because of tightness of structures around the shoulder joint. Commonly a structure called as capsule which shrinks, that causes frozen shoulder. Frozen shoulder can be treated with simple exercises, mainly the stretching of the shoulders. And who can't recover with the simple exercises, you might require an injection into the shoulder joint which is going to relieve your symptom. The second symptom is pain. The pain, especially when you try to move your shoulder, indicate that you have a shoulder problem. So the pain in the shoulder commonly because of a condition called as impingement syndrome and also because of another condition called as rotator cuff tear. Rotator cuff are a group of muscles present inside the shoulder joint which helps in movement of the shoulder. A small rotator cuff tears can be managed with the simple exercises and home-based medications and also application of heat. If the rotator cuff tear is big enough, then it has to be fixed with a small keyhole surgery which we call it as arthroscopic rotator cuff repair. So the third symptom which I'm going to explain is popping out of the shoulder. It's also called as shoulder dislocation. This is a condition where when you try to throw a ball or try to lift an object, your shoulder can move out of the position. This is called shoulder dislocation. Shoulder dislocation is commonly because of a major injury, but it becomes recurrent. That is, every time shoulder dislocates with simple movements, that indicates that you have a recurrent shoulder dislocation. The minor dislocation or dislocation happening once in a while can be managed with simple strengthening exercises. If your shoulder dislocates very regularly and very often or dislocates even during sleep, that means it has to be fixed with a small surgery. Many times we can manage this with a small keyhole surgery. To summarize, the common symptoms which indicate you have a shoulder problem are pain in the shoulder, especially when you try to move your shoulder, disturbed sleep because of the pain, stiffness in your shoulder, and shoulder dislocation. Hope you enjoyed this video and this video was informative. Thank you.